This presentation is about motivational interviewing. It was put together by Nancy Budd, Annie Davison, and Sarah Robinson. Motivational interviewing is a counseling approach that was developed by Professors William Miller and Stephen Rolnick. The concept evolved from their experiences working with problem drinkers. Miller first described it in an article in 1983, and then in 1991 the two professors worked together to elaborate on the concepts and clinical approaches. According to Miller and Rolnick, motivational interviewing is a directive, client-centered counseling style for eliciting behavior change by helping clients explore and resolve ambivalence. It is considered to be more focused and goal-oriented than non-directive counseling. The idea behind motivational interviewing is that the motivation to change comes from the client and is not imposed by someone else. This process relies on identifying and building the client's intrinsic values and goals to spark behavior change. Motivational interviewing also believes that it is the client's responsibility to articulate and resolve their ambivalence. Ambivalence is seen as a conflict between two courses of action, like indulgence versus restraint, and each course has perceived costs and benefits. It is the counselor's job to facilitate the client exploring both courses of action. Because the client needs to resolve the ambivalence on their own, direct persuasion, confrontation, and arguing are not part of this counseling approach. Lastly, the therapeutic relationship is more like a partnership than an expert-recipient relationship. There are times when the counselor may provide information, but ultimately the counselor should respect the client's autonomy and freedom of choice. Because of all the above reasons, motivational interviewing is seen more as a style of interaction rather than a technique that is used on someone. Motivational interviewing got its start in the substance abuse field, so it most strongly associates with the treatment setting. However, there is more research being conducted in other fields outside of substance abuse that are showing promising results. According to Miller and Rolnick, motivational interviewing can also be used to address anxiety, depression, PTSD, other problem behaviors, obsessive-compulsive disorder, suicidality, eating disorders, pathological gambling, medication adherence in individuals with schizophrenia, co-occurring disorders, and in the correctional system. Because of how it addresses the ambivalence and allows the client to explore their options without the counselor telling them what to do, it is an ideal counseling approach to use when working with mandated clients. When motivational interviewing was first created, it was based on clinician experience rather than being founded in theory. While it may not prescribe to a specific theory, the ideas and spirit of motivational interviewing match up well with empowerment theory and humanistic theory. Empowerment theory sees the social worker as a peer and partner in solving problems, and the focus of the intervention is to support people to define their own goals and participate in the decision-making and planning. Humanistic theory assumes that individuals have the capacity for growth and the freedom to choose their identity. Like with the empowerment theory, humanistic theory sees the role of the social worker as a guide and collaborator rather than an expert. Motivational interviewing was strongly grounded in Rogers' person-centered therapy, which has the goal of giving clients a chance to see how their feelings and behaviors are being negatively affected and in turn make an effort to make positive change. The general principles of motivational interviewing can be remembered with the acronym DEARS: develop discrepancy, express empathy, amplify ambivalence, roll with resistance, and support self-efficacy. Develop discrepancy refers to helping clients examine the discrepancies between their current behavior and their future goals. When they are able to see that their current behavior does not lead to meeting those goals, they are more motivated to make changes. Expressing empathy is critical to the motivational interviewing approach because it allows the client to feel understood, and when they feel understood, they are more likely to open up about their experiences. Ambivalence to making change is normal, but sometimes it can be overwhelming and leave the client stuck. By verbalizing the ambivalence, it helps the client acknowledge it and then explore the two courses of action. It is important in motivational interviewing not to fight client resistance, but instead to roll with it. By rolling with it, the counselor can use the client's momentum to help the client further explore their views rather than forcing them into defensiveness. Lastly, supporting self-efficacy means the counselor is focusing on their effort on helping the client stay motivated to choose and carry out actions. Another motivational interviewing acronym is OARS, and it refers to the skills and techniques the counselor can use in a session. Motivational interviewing works best when the counselor is doing 50% or less of the talk in the session. Counselors use these skills to provide a safe environment in which the client feels free to open up, feels accepted, and to develop a relationship of trust with the client. Open-ended questions are used to get the client talking about their situation in their own words. Counselors pay attention to their thought process and listen for statements of ambivalence. Counselors use affirmations in response to positive behaviors and strengths that the client has exhibited. Affirmation statements validate the client and helps to build rapport with the counselor. Through the use of reflective listening skills, the client knows that they are being heard and understood, or if the counselor misunderstands them, they are able to correct it right away. With summarizing, the counselor will pull together all the statements of ambivalence shared throughout the session and restate them to the client. At this point, the counselor would ask the client if they are ready to make a change. With simple reflection, the counselor is simply repeating back what the client had just said. With amplified reflection, the counselor is repeating back an exaggerated version of what the client said to the point where they may disagree. It is important not to exaggerate it so much that the client thinks that you're mocking them. In a double-sided reflection, the counselor repeats back to the client their current resistant statement while also repeating a previous statement that the client made in the session that contradicts what they're saying now. Another tactic to reduce resistance is to shift topics. Finally, reframing is a strategy where the clients look at their perceptions in a new light. Reviewing a typical day is one potential strategy that allows the counselor to build rapport while gathering more information. The focus of this discussion should not be about the client's problem behaviors, but instead see how the problem behavior fits into the daily life of the client. With looking back, the counselor engages the client in a conversation of what life was like before their problem behaviors. The goal is not to resolve issues from the past, but instead to show the path between how things were and how things are now. The good things and less good things strategy has the client reviewing what is good about their behavior along with what is not so good about their behavior. It's like making a pros and cons list. The language of good and not so good is intentional. It is an attempt to keep the language that is closer to what the client might use, since they may not identify their behavior as bad. In order to talk about the stages of change, the counselor may give a brief explanation of each of the stages and then ask them where they think they are in terms of their problem behavior. It can even be approached regarding any changes that have been made in the past, like dieting or exercise, and this can allow for a discussion of what it takes to move within the different stages without directly addressing what they are in treatment for. In one study, problem drinkers were offered a 2-session motivational checkup. The clients that were randomly assigned to receive motivational interviewing, compared to a more direct confrontational interaction approach, showed more change talk and a decrease in drinking within 6 weeks. The same problem drinkers randomly assigned to receive motivational interviewing also showed significantly less resistance during their sessions than the control group did. In another study, adults presenting for non-alcohol related medical appointments were screened for hazardous drinking patterns and then were assigned to either usual care or a brief motivational interviewing intervention. Those assigned to the motivational interviewing treatment reported less drinking at a 6-month follow-up. One study looked at drinking and driving. Teens presenting at an emergency department for an alcohol-related event were assigned to either standard care or a motivational interviewing intervention. Those who didn't receive the intervention were 4 times more likely to report drinking and driving at a follow-up. Another study looked at substance abusers enrolled in outpatient treatment at a community-based treatment setting that participated in either standard intake or an intake with motivational interviewing elements. The motivational interviewing intake clients were significantly more likely to be still enrolled in treatment after 28 days. In one last study, duly diagnosed patients were assigned to either an adapted MI treatment or standard psychiatric interview. Those who participated in the motivational interviewing whose drug of choice was cocaine had significantly better treatment outcomes when it came to cocaine use at follow-up. In our second video, we will be demonstrating the core skills and techniques used in motivational interviewing to enhance a client's intrinsic motivation for change through the client interaction. Some specific skills and techniques you will be able to see will be rolling with resistance, reflective listening, and the use of open-ended questions, just to name a few.